Infectious disease experts warn that children with prolonged coughs may be experiencing a type of pneumonia on the rise in the U.S. this year, requiring a different antibiotic regimen. Dr. Buddy Creech, a pediatric infectious disease specialist at Vanderbilt University Medical Center, noted, "We've been monitoring this since early summer, when we observed a significant increase in children with what appears to be this particular type of pneumonia." Creech mentioned that in August, four pediatricians in Nashville reached out to him for guidance after seeing an unusual rise in coughing children. These doctors sought advice because the typical antibiotic, amoxicillin, seemed ineffective for these cases. According to the CDC, this pneumonia, caused by Mycoplasma pneumoniae bacteria, is spiking this year, particularly among preschool-aged children. The CDC recently issued a notice to parents and healthcare providers about this increase. Mycoplasma pneumonia is the latest addition to a growing list of respiratory infections demanding attention this fall. Pertussis cases, another illness causing prolonged coughs, are 5 times higher than last year, and respiratory syncytial virus, RSV, is also increasing in parts of the U.S. Historically, testing for mycoplasma was challenging since the bacteria doesn't grow well in petri dishes, the standard, though slow, method for bacterial infections. However, Creech said improved diagnostic tests now allow faster and more reliable detection of these bacteria. With so many bacteria causing coughs in children this fall, it is crucial for doctors to use these new diagnostic tests for accurate diagnoses, he added. This is a time when diagnostic tests that can guide treatment are essential, he said. The CDC stresses awareness of mycoplasma trends since leading pediatric antibiotics like amoxicillin and penicillin are ineffective against it. However, infections are usually treatable with alternatives like azithromycin. Data from CDC hospital networks and commercial labs show that emergency room visits by 2 to 4-year-olds testing positive for Mycoplasma pneumonia increased from 1% in April 2024 to 7.2% in early October, a 7-fold rise. Diagnoses in older children also doubled during the same period, from 3.6% to 7.4%, while Mycoplasma cases appear to have peaked in mid-August. The CDC reports they remain elevated. Creech expects levels to stay high for about another month before tapering off in late fall. On X-rays, Mycoplasma infections may present as cloudy or white lung. Last year, China, Denmark, and France also reported rising cases of this type of pneumonia in children, Dr. Jeffrey Weinberg, a pediatric infectious disease specialist at the University of Rochester Medical Center, attributes this rise to at least 3 factors. First, Mycoplasma infections are returning to pre-COVID-19 levels. It seems dramatic now because nearly all infections dropped during the COVID-19 pandemic, said Weinberg. But national rates are quite similar to those before 2019. The second reason is that most infections are cyclical, with some years worse than others. Mycoplasma outbreaks tend to occur every 3 to 7 years as immunity wanes, Creech said. Sometimes it's just a bad year, compounded by not seeing it for a while, so we're now getting more cases, Weinberg explained. He added that the lack of cases in recent years has made this surge feel larger. The third reason is improved, multipurpose tests that can screen for multiple viruses and bacteria simultaneously, leading to more frequent detection of this infection. Mycoplasma pneumoniae is spread through respiratory droplets, with infections commonly transmitted in close quarters such as schools, college dorms, and nursing homes. The bacteria are challenging to detect as they incubate in the body for 1 to 4 weeks before causing illness. When symptoms appear, people often can't remember what might have exposed them. Mycoplasma infections typically start with general symptoms like headaches, sore throat, mild fever, and chills. People often feel unwell but can still go about their daily activities, hence the term walking pneumonia. The cough is usually dry and persistent, gradually worsening over 2 to 3 weeks until it becomes almost constant. Not all Mycoplasma cases require treatment. According to Weinberg, up to 75% of children and adolescents recover without therapy. However, the infection can exacerbate pre-existing conditions like asthma, causing more severe illness. in rare cases, Mycoplasma bacteria can spread beyond the lungs. They may infect the lining of the brain and spinal cord, as well as nerves affecting vision, bladder, and legs.